Louise, so we were thinking about a whole lap. 8 times what you did yesterday.
Today we mobilised the patient ventilated on an endotracheal tube. It involved risk assessment of the patients and how their ability is to mobilise, as well as adequate staffing to move the various attachments and medical staff to look after the endotracheal tube to avoid any adverse incidents.
She's a patient with congenital heart disease who has had a difficult post-operative course with respiratory failure. Otherwise, she's made a good recovery and she's not needing lots of organ support apart from the ventilation.
It's rare that we have patients who are on endotracheal tubes long enough to mobilise within intensive care. This patient is one of few who is fit enough to be able to mobilise on the endotracheal tube whilst still being ventilated.
She's too fast for us.
The main issue with Louise is trying to get her pushed forward in terms of her respiratory function. So lying in bed isn't as good for your respiratory system. Being able to get up, open your lungs up better, and being able to breathe a bit harder while you're mobilising around the ward will all help Louise move forward and hopefully get that breathing tube out in the near future.
Patients who normally are ventilated with an endotracheal tube are normally on bed rest and are not able to get out of bed because of this. So being able to get the patient up to sit in a chair and being able to mobilise the patient will help their muscle strength, improve their power and their ability to move around and mobilise. And also respiratory wise, they're able to expand their lungs more, able to clear any secretions that may be in their chest to ultimately improve their respiratory function. She seemed to have fun and benefit from it. Her family were in attendance as well to see her being up and about on her feet, which is great from a psychological point of view, for her to be able to get out of bed, get out of the room and see a bit of the unit.